Having knowledge and skills related to information management and the use of technology to deliver patient care are critical to the implementation of quality patient care. This chapter discusses the Technology Informatics Guiding Education Reform, or TIGER, initiative, and the associated nursing competencies that all nurses need to have as they enter the healthcare workforce. We will discuss the difference in knowledge and information and how workflow, clinical practice, and leadership is influenced by healthcare technology. Information competencies are required for all nurses in order to improve nursing workflow and delivery of quality care. The TIGER initiative developed guidelines for effective best practices in the use of knowledge and information in healthcare information systems. The three areas of competency are basic computer competencies, information literacy, and information management. While the focus of pre-licensure education includes understanding and use of health information systems, the concepts of privacy, confidentiality, appropriate access to health information, and maintaining security of health information are essential competencies for all nurses. The AACN Essentials of Baccalaureate Education's Essential 4 provides specific guidelines for competencies for all nurses entering practice with a BS in education. Both use of technologies and the ability to apply safeguards and use decision-making support systems to guide practice are essential competencies for the new graduate. Post-graduation, it is important for nurses to maintain their competencies and understand how new technology can be used to provide and improve care as well as guide patients in self-care management. Staying abreast of practice changes is important for all practicing nurses. CEUs, or continuing education units, are required for renewal of the RN license in at least 30 states. CEUs can be earned through participation in conferences, through online CEU offerings, or through completion of certificate programs available from organizations such as the Institute for Healthcare Improvement's Open School. Your text provides a table of other resources where you can get more information on organizations that provide information technology education. There is a difference between the information and knowledge. Information is developed as data is structured into meaningful and understandable information. An example would be the entry of patient demographics into the computer system. Knowledge becomes knowledge once it is synthesized in a way that relationships are identified and formalized to support clinical decision-making. Knowledge of which interventions work best to improve patient outcomes can be used to develop best practices. Clinical informatics makes it possible for nurses and other clinicians to access clinical resources to guide practice. These resources include evidence-based guidelines, protocols, and procedures for use in the clinical setting. These guidelines, protocols, and procedures are essential to providing safe and effective quality care to patients. The textbook provides examples of commonly used clinical resources. The Institute of Medicine has issued aims for all healthcare providers that are measures of quality care. All quality improvement initiatives must address these measures of effectiveness, safety, efficiency, patient-centeredness, timeliness, and equitability. A holistic system is used to focus on all aspects of an organization. The CQI, or Continuous Quality Improvement Process, makes improvement the primary purpose for the organization. The Agency for Healthcare Research and Quality website, or AHRQ, provides tools that organizations can use to guide continuous improvement. The link to the AHRQ Quality Indicator site gives you more information about this organization's goals and aids to quality improvement in healthcare. Nurses use technology in all healthcare settings and must interact with multiple medical devices and health information technologies. Healthcare information technology has a profound effect on the way nurses provide care. A key to how well IT is implemented into nursing workflow are the attitudes and the perceptions of the nurses who work with the technology. Here is where nursing education related to informatic technologies can be key to successful implementation of the technology into workflow. Nurses are integral members of any group that is designing and planning the implementation of a new clinical system. A high-level informatics system can guide care by providing reports of care at other facilities, providing just-in-time essential information that can assist in medication decision-making, and can also facilitate referrals and transfers of care from one facility to another. Some of the negative effects reported by nurses are inefficiencies in providing care when a system where information is either difficult to find or where documentation must be completed in a number of different screens. Information systems can also be used to evaluate the workflow of nurses in terms of cost, time, and effective use of a number of other factors, such as the use of protocols, the evaluation of complete documentation, and the use of clinical decision-making tools.